Hey guys, Dr. Chris here. I got a great lunch and learn for you guys today, and it all has to do with this little machine right here. Now, if you guys are already a patient in the practice, you guys have had your hand in this at least once at your first appointment, or maybe dozens of times now, depending upon how many years you've been around the practice with us. And yet, the question is, why do we do this? Why is this thing so important? Right? Well, we got to kind of take a step back first, because we got to understand, to understand why this matters, we have to understand first what this applies to your health. And so the reality is that we all know that stress is not a good thing. Yet we all experience stress. We all experience different forms of stress in our life. Physical stress like traumas, poor postures, accidents, injuries, all of that. We have mental emotional stress of our work, our relationships, finances, like all this stuff that's happened this last year, right? All these mental emotional stresses, kids not in school, all the different things that happen with that. We have chemical stresses, right? The environment, our diet, things like that. So we have these physical, mental, emotional, and chemical stresses that we all experience, our children all experience, from as early as the birthing process all the way throughout our life. Now, we all know, and you've heard us say this before, that we are designed to be healthy. Your default state is to express health and to heal. You were never designed to be full of sickness and disease as your kind of baseline state. But all of us, right, because we experience stress, can start to have health challenges that arise. And we go from a state of health and well-being, right, and feeling great and having no pain and having all these good things, to things like getting sick on a regular basis, or poor sleep, or anxiety, or poor digestive function, or all kinds of different issues. And so the question becomes, if we know that we experience stress, how do we know how that stress is affecting us way before we have all these severe things showing up in our life, right? Because down the road, what does that look like? In America, the number one thing is heart disease, number two thing is cancer, number three thing is diabetes, right? And the list goes on and on to autoimmune diseases and all kinds of different health problems that run rampant in our country. And so the question becomes, if we experience stress, how do we handle that stress? How is our body adapting to stress? Because that's the real key. Yes, we can get rid of some stresses in our life, but the bigger thing is, how do we adapt to it? And that's where this guy comes in, right? Heart rate variability is what we are actually testing when we use this. And it's not really a heart function test or assessment, even though it has heart rate in the word. It's looking at the balance of what we call the autonomic nervous system. So the autonomic nervous system, think automatic, is the nerve system that controls all of our organs, blood vessels, glands. Every single system of our body is controlled by this. So our immune system, our digestive function, our hormones, all these things are all controlled by the autonomic nervous system. And if you notice on that diagram, there's two different sides. You have nerves that are called sympathetic nerves and nerves that are called parasympathetic nerves. Now, we like to keep it simple around here. Gas pedal, that's sympathetic, that fight or flight stress response. Brake pedal, that's parasympathetic. Now, when we do heart rate variability testing, we can actually measure and see, are we in balance, or are we caught up, let's say, more on that fight or flight stress response side? And then later on we can check back in with this, and we know that specific chiropractic adjustments, as well as specific lifestyle changes and things that we do outside of the office, can help to improve that heart rate variability. Because here's the big takeaway, and here's the big kicker with this. The better your heart rate variability, the better longevity of health you're gonna have, and the less likely you or your child is gonna be for all kinds of chronic illnesses and diseases. And that is why this matters. Because the healthier you are, the better your body is adapting to stress, the better your quality of life. And so for us, we don't just do this once, we do this on a repeated basis, because as we've seen this last year, the stresses of our life go like this, right? There's days or weeks where things are a lot better or less stressful, and there's days or weeks where things are a lot more stressful, or years, right, with 2020, that are a lot more stressful. And so if we don't actually measure and know how our body is adapting to that stress, then we're just waiting until we have way more chronic pain, inflammation, some kind of major problem starts to develop if we aren't checking it and then adapting what we're doing to take care of ourselves for that. So I hope this gave you guys some insights today. We love heart rate variability around here because at the end of the day, it helps us be better doctors for you so that your body can heal, function, and adapt to your life or your children's lives so much better so you guys can live the life that you were designed for. So again, Dr. Chris here. Hope this really helped open your eyes a little bit more to heart rate variability and why we do it. And stay tuned next week. We're going to talk about one of the other scans about how that applies to your life and your child's life as well. Thanks.